Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. I have another question that I've been asked about, and that is in regard to cardiac rehab. Is it really necessary? Well, in my opinion, and again, I'm not a doctor, but I am a cardiac patient. I've had 3 heart surgeries. And it is my opinion that it's most certainly worth it if you have the insurance coverage to pay for it, and if your cardiologist recommends it. And it really doesn't matter what your age is, whether I was 42 when I had my first heart surgery, and I was 55 when I had my third. But each time that I went through cardiac rehab, and I did it all 3 times, I'm going to tell you my experience. But as long as the insurance pays for it and the doctor wants you to have it, I strongly recommend that you do. And it has nothing to do with whatever kind of conditioning you're in already. Because here's what happens. You've traumatized your heart with that surgery. And again, in my case, I've had a double bypass. I've had a stent placed inside my RCA artery. And I've had an aortic valve replacement, which I've shown this bad boy several times already. This is a replica of the valve that's actual size that's in my heart right now. But each time I went through cardiac rehab. Now, prior to that, I exercise, so it shouldn't be that big of a deal. That's all they want you to do is exercise, right? And you've rested a couple weeks or whatever they told you to. It shouldn't be that hard to get back into. But you've traumatized your heart with each surgery. And there's one advantage to going through cardiac rehab that you don't have going to the gym on your own and doing your own thing. When you go for cardiac rehab, the facilities are normally filled with nurses and other cardiac techs that sit behind a computer, and you are wired up to a portable heart monitor, which transfers the information to the computer where the techs are and the nurses are looking at a screen of your heart rate. Basically, an EKG is what it amounts to. And then they are giving you precise exercises to do, whether it be on a treadmill, whether it be on an exercise bike, a recumbent bike, a hand bike, an elliptical, whatever. They set the pace for you to do, the stress for you to do, and they gradually increase you each rehab appointment that you have. And as they're doing it, they're watching the screen. They're looking for anything to pop up electrically from your heart to them, that if there's a problem, they can stop you from exercising. They can respond to you. They can address whatever situation you're dealing with. If it ends up being nothing, you continue on. If it ends up being something, you get help. Well, if you're at the gym, you don't have that. Okay? And if you're, 2 weeks in and all of a sudden you've got something funky going on with your heartbeat, whether it's tachycardia, whether it's a skipped heartbeat or anything else like that, you're not going to know just on your own. So cardiac rehab generally goes about 36 appointments. It's about 9 weeks. Okay? A lot of times they'll schedule them 3 times a week. And you go through, and each week, each appointment, chances are the nurse and the cardiac tech will increase your stamina load, and you will get stronger, and it will be apparent to them that everything is going well with your heart and the recovery. And at the end of the 9 weeks, they give you a little diploma that says you completed cardiac rehab, and you should be clear to go back and resume whatever activities you went. But the thing that I have to stress to you, okay, like I said, I see it happen all the time as a healthcare advocate. I've seen people who have said, I don't need cardiac rehab. I've seen people want cardiac rehab and be denied and then have to fight for it. Okay, like I said, there's no harm to having cardiac rehab done if you can get it, if your insurance will cover it, and if your doctor will order it. But I have seen people being stopped during cardiac rehab. It's basically a gym type area, and there can be anywhere between 5 and 20 other patients there rehabbing. I've seen patients stopped because the nurse behind the monitor saw something go wrong with somebody's measurements coming through the leads. And that's the place that you want to be able to have it taken care of. You know, if you're at your local gym or your community gym and something happens, you're on your own, and it could end up being quite tragic. So my advice to you, and I don't usually give medical advice, if they offer you the cardiac rehab, it's definitely worth it. Until next time, this is Paul's Heart.